The views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Good evening and welcome to BronxTalk. Well, is it time for Here We Go Again? Earlier last week, the city upgraded its COVID alert status to high due to a surge in people testing positive and being hospitalized for the virus. As a result, officials are emphasizing indoor mask wearing, caution in groups and crowds, and of course, there's the ongoing push to make sure everyone is vaccinated. But there are still a number of questions. Why are we spiking now? Will people comply without actual mandates? Are there variants out there that could be even more contagious and more acute? And what should you do if you're ill? We have two experts with us tonight to navigate those issues and more. One works citywide and the other is on the ground here in the Bronx working to keep us all healthy. So please join me in welcoming the physician in charge of the Center for Health Equity and Community Wellness for the New York City Department of Health and Mental Hygiene, Dr. Julian Watkins. Dr. Watkins, nice to see you.
Nice to see you.
The Assistant Vice President for Medical Regulatory Policy and External Affairs for Urban Health Plan, it is Dr. Viju Jacob. Dr. Jacob, welcome back to the program. Nice to have you with us.
Thanks, Gary. It's good to be back.
Dr. Watkins, let's start with you. Why? Why did we go up one notch here and people seem to be getting along? I mean, we all move around the city of New York. We're wearing masks essentially on all the trains and buses and in other public places. Why the higher alert?
Well, it's a combination of many different factors that got us to this higher alert level. There's a combination of there's social changes. You know, mask mandates had come down. The city has opened up to a level where we haven't seen in a very long time. That combined with new highly contagious variants circulating around the city, all of that has come together to get us to where we are right now.
The mayor has made it quite clear, and I think it was all the way right, even in his campaign or soon after he was elected, that we have to learn to live with the virus. Are we not doing a good job living with the virus, or is this one of those kind of benchmarks to find out how well we can do to actually live with this virus without, of course, shutting down the city and all the ramifications of that?
Yeah, I mean, I think that New Yorkers are very resilient, and I think that we actually have learned to live with this virus. I think that we've learned a lot of lessons over the last 2 years, a lot of survival lessons, and we've gained a lot of tools. And I think now we're just facing these new highly transmissible variants. But, I'm sure that we can definitely get through this wave, just like we got through a very high, very impactful wave earlier this year when the Omicron variant first came to our city.
I hate to ask it this way. Did we do something wrong? And I don't mean the city's policy or anything like that, but people, did they behave wrong? Or was it really just a case of a new variant? We all kind of thought that was gone and now we're into a new step. But the new variant came out and, of course, apparently highly contagious. How do you assess what we've done?
I think that the new variant came at a really inopportune time. It came at a time where we were ready and poised to kind of move into a new year and try to move forward through the worst of this pandemic. It definitely threw a curveball, but I'm definitely on the side of people, and I think that we can overcome this and we can outsmart it, and we can get to the other side of this wave too.
Before we bring in Dr. Jacob, I want to show the city put out some guidelines. Here are, you can see what the numbers are. The numbers are 338.33 per 100,000 cases. That is a stable number. That is not going higher or lower. New hospitalizations are increasing 10.5 per 100,000. The hospital occupancy, 4.36% of COVID-19 patients is increasing, and the deaths, there were 6, is increasing. One of the things, Dr. Watkins, that I noticed from looking at these numbers is that, in the old days, if you said that we only had, which believe me, each death is tragic, if we only had 6 deaths in, or 4.83 occupancy in our hospitals, if that had happened in 2020, I think we'd be jumping up and down celebrating that we, kind of have solved the problem. But now that's concern. That's what's interesting to me is these numbers seem particularly low. But I thought it was interesting that the city created a high alert with those low numbers. Relatively low.
We're following the public health trends. We're definitely following the recommendations of the Centers for Disease Control. We're also just following where the science has brought us. The science of the vaccines, the science of treatments, the science of boosters, all of these things have got us to a much better place. And I think, as you said before, we are learning to live with this virus and make it so that individual cases aren't so life and death because we have all of these interventions and all of these things that we can do to keep ourselves and our community safe.
I want to put up those guidelines. We have the alert level is high in New York City. What it means and what New Yorkers should do: stay up to date with vaccines, of course, get vaccinated and boosted, wear a face mask in all indoor public settings and crowded outdoor spaces, consider avoiding high-risk activities, crowded indoor get-togethers. Certainly if you're on the train or bus, as we said earlier, wear a mask, limit get-togethers to small numbers, and if you have symptoms, get tested. If you traveled, also get tested. And of course, if you're sick, stay home. Last question for you before we bring Dr. Jacob into the discussion. Can New Yorkers follow this sufficiently to drive down numbers without being mandated to do so? We all, frankly, feel free. I've been to the ballpark a couple of times and nobody's really wearing masks there. Of course, that's outdoors, but then there's indoor spaces. Do we need mandates, or are you and your colleagues thinking about mandates, or are we okay as we are?
I think that public health is much more than mandates. It's much bigger than mandates. I think that's one of the tools that we have, but we also have defined tools of, education. We have defined tools of engagement. We're able to distribute resources and get things that people need so that they can keep themselves safe. I think mandates are always part of the conversation, but I think that I have trust and faith that we actually can suppress this wave like we've suppressed other waves, and we don't necessarily always need a mandate. But we'll see based on where the numbers go and what the science tells us.
Well, maybe programs like this, where we talk frankly and openly about it, will encourage New Yorkers to just be a New Yorker, be cool, be smart, take care of yourself. Now, which leads us right to Dr. Jacob. Fascinating for me to learn that Dr. Jacob very recently tested positive. You know all the science. You deal with people all the time who come in with COVID. You, I'm assuming, take expert precautions, because who could know them better than you? And yet you ended up with the virus. Do you want to tell us a bit of the personal story, how you got it, where you're at? Certainly we hope and pray that you're feeling well. Just give us a little background. And I think it's instructive. Here's an important health official in the Bronx who also tested positive.
Sure, Gary. I think the combination of the variant and, things that we don't think are potentially exposures, right? So as you said, I've been doing all of the things that we recommend to all of our patients, right? So avoiding large crowds, making sure I have a high quality mask, so, KF94, a KN95 or an N95 mask on. But, we have family. So, I had a death in the family and we went to the funeral and we kept our masks on all the time, but we ate together. And, I suspect that meal is what sort of got myself and my mom infected. The good news is, as Dr. Watkins said, we've had the luxury of vaccines, testing, a lot of things that we did not have 2 years ago. which allow us now to be a little bit more confident, right? So at one point, like you pointed out, getting COVID was very close to a death sentence, right? We had so many deaths tragically in the city. And as tragic as each one of those deaths that are happening now are, it's minuscule compared to where it was before. And a lot of that has to do with an effective rollout of vaccines in our city, boosters for a large percentage of our patients. We'd like them to get more, but a large percentage of our patients have been boosted. So I think those are what's allowing me, freshly COVID positive to still be on a show like this today.
And how are you feeling, sir? I mean, we certainly hope you're well. And I'm going to admit, which I've never admitted publicly, I about a month ago tested positive. Me and my wife did, so I learned something about it. But how are you feeling?
So far, so good. So I think I've had the benefit of the vaccines and the boosters. So my symptoms have been very mild. I've also, taken this advantage, as I have for my patients, to recommend treatment. So my mom and I both started Paxlovid, which is the oral antiviral. The city has made it exceedingly easy. They will deliver it to your house. If you test positive, speak to your healthcare provider. They can prescribe it for you. If you don't have a healthcare provider, the city set up an entire system of where you can speak to one of the city doctors and they'll prescribe it, and the pharmacy will deliver it to your house. So I took advantage of that and started treatment. And within about 48 hours, I was feeling what little symptoms I had completely disappeared.
I'm going to tell you the same thing, that it was delivered right to my door once it was prescribed by my physician. And I had the sense that if you have the flu and you're not feeling well, you eat chicken soup, you get plenty of rest, you drink plenty of fluids, you take, whether it's aspirin or Advil or Tylenol, whatever is your preference, you take that and you start to feel better. But with this, that stuff didn't really help. Once I took and my wife as well, once we took the Paxlovid, we had the sense that it was the thing that was driving it out of our bodies. So now I want to ask you about your expertise and your work. What are you seeing at Urban Health Plan from Bronxites? Are they vaccinated? Is it people who are not vaccinated who are more likely to get sick? Just give me your firsthand experience, if you would.
Yeah, I mean, so, unfortunately, there are patients testing positive, and, I don't think it's a fault of anybody. People have to live their lives, and, as cautious as they are, like my example, there are situations that potentially put us at risk at all times. We are seeing, our positivity rate go up both in our patients as well as in our staff. The good news is most of them seem to be doing relatively stable. Very few of them are requiring hospitalizations, and I think that's because we have a fairly high vaccination rate among our patients. The city as a whole has a fairly high primary vaccination series. While we had the booster mandates in place, a good chunk of the adult population in the city compared to the rest of the country have gotten their boosters. So now we're continuing to work at Urban to make sure that we are continuing to have vaccines available at many of our sites on an ongoing basis to encourage our patients to keep coming in and getting vaccinated and boosted.
I think it's time then to throw it back to Dr. Watkins. Many people had questions that say, well, okay, I did the 2 vaccinations and then I'm asked to do a booster. And now there seems to be some hesitancy about requiring or advising the second booster. And then I want to add along with that, if there are new variants, are we going to boost each one of those as we go along? What is the city's policy, especially that you hear from the FDA and the federal authorities and the CDC about what should be done with boosters?
As with this pandemic, we follow the general public health guidance. And we have established guidance and established precedent with other boosters. We're really familiar with vaccinations as part of pediatric standards of care and adult medicine standards of care. So we're just really following where the evidence leads us. And I think a big point that I like to share when I talk to communities is the recommendations are always following what's going on in our cities, like on our streets, and the recommendations for boosters, updating boosters, when to update them, who should be recommended. It all depends on what's going on in the real world and what this virus is actually doing. Unfortunately, this virus has, has humbled us many times over the last 2+ years. But I'm confident that we can kind of keep up with it and actually, meet it right where it is, so we can save as many lives and protect as many folks.
So the number I have is 88% of adults in New York are vaccinated. 46% are boosted. You, I'm assuming, following the guidelines, would recommend that third shot. And at the moment, the fourth shot is not fully recommended yet.
So the additional booster, the second booster dose, is recommended, highly recommended for particular groups, 3 in particular. So people who are 50 years and older, regardless of past medical history, people who are 12 years and older, and who are immunocompromised due to an underlying health condition or due to a medication that they're on. And then also additional boosts are recommended for folks who've been vaccinated and boosted with the Johnson & Johnson vaccine. Folks can get those second boosters after 4 months.
I want to ask both of you to comment on this. The city put out a map, and we're going to show the map, which I thought was fascinating because in most of the cases, and you can see without going into too much detail, the lighter colors, which are indicating a less concentration of people who have tested positive, are in the Bronx. And that was striking to me because normally it's communities of colors, vulnerable communities that have shown greater infections. So I'm just curious, Dr. Watkins, how do you read this map? And look at Staten Island has got the darkest colors. Is it because Bronxites are not getting tested, or you think there are actually fewer infections in the Bronx? And then, of course, we'll go to our man on the ground, Dr. Jacob, and ask him to comment as well.
That's a really good question. I think it kind of just reflects where we are in the testing realm right now. I think the Bronxites are testing. I think a majority may be testing with the at-home tests, which are very available. I think that what we're seeing on the citywide maps are reflecting these PCR tests or these tests that are reported to us. But I think the main takeaway is that the trends are increasing across the 5 boroughs. And I think following that trend is where the guidance should come from. And I think Bronxites, to keep themselves safe through this part of the pandemic, through this wave, follow the recommendations for the whole city, because we are the city of New York, and it's really easy to go from borough to borough, and many people have trans-borough lives.
Oh, that's an interesting comment. But of course, here we're pretty rooted in our home BX. So there we go, Dr. Jacob. Who's coming in testing positive? Is there a trend that, and I realize we're talking generalities, of course there are numbers out there, but what is your sense of who you're seeing and who Urban Health Plan is seeing, specifically in the South Bronx?
I can't say we as an organization can specify a particular group that's coming in more frequently testing positive than others. But in general, like Dr. Watkins said, I think there is a much more availability of home testing right now. And, a lot of our patients come in, requesting secondary testing, right? They tested positive at home and they just want to confirm with us. A lot of our associates are testing positive on home kits. They're not getting us reports from a doctor's office or a PCR. So, I think that's clearly availability of that is more. My personal gut feeling is Bronxites are also much more likely to work in municipal jobs, right, which had mandates that made sure that they were vaccinated, boosted. They also took the brunt of it. So many of them have been infected once, if not more than once. So I think the combination of all of those, I am hoping, is offering the Bronx a little bit protection compared to the other boroughs.
Can you be reinfected? This has come up a number of times, and both of you can weigh in on this. Dr. Jacob, you first. Can you be reinfected?
Sadly, yes. Definitely between the different variants, there are clearly cases of reinfection. I think the shortest case I read about is in Spain, where a healthcare worker tested positive between 2 completely different strains within 21 days. So they had Delta once, and then 21 days later had a completely different infection with Omicron. So Omicron and its subvariants seem to be playing all kinds of chaos with all of our previous understanding of protection.
Your thought on that, Dr. Watkins, about reinfection? Are those some of the numbers that are driving this spike for the city of New York?
Yes, as Dr. Jacob said, the Omicron variant has definitely been a game changer. It's changed the conversation around vaccine-induced immunity, but I think even more, it's changed the conversation around natural immunity. Being infected with a prior variant, and even what we're seeing, some evidence being infected with the original Omicron strain, you can still get infected with these subvariants, and that's why being vaccinated and relying on all the tools that we have to keep safe is so important, and the urgency of the conversation has shifted a little bit.
Well, we're going to ask you this and then back to Dr. Jacob to respond as well. As I understand, and I do know somebody who has this, they passed through, they had COVID and they're testing negative now, in fact, 2 or 3 times, but they still have a cough. And the cough is going on. Is this part of this whole idea of long-term COVID? Does it need to be treated? Do we sit and just wait for it to go away? Does it go away? We'll let you both weigh in. Dr. Watkins, you first, and then Dr. Jacob.
Long COVID is this silent pandemic that we're seeing unfold all around us.
Oh.
There's estimates that 1 in 10 or 1 in 3 people who are infected with COVID-19, even if they have an asymptomatic infection, have these long-term or lingering side effects or symptoms. Long COVID is real. We're learning more and more about it every day. There's a few sites across the city to actually study it, these COVID centers of excellence. And we actually have an upcoming symposium hosted by the health department and health and hospitals later this month, early next month, to really try to help the medical community and community health workers to really learn more about this based on what the evidence shows right now.
Dr. Jacob, do you and your colleagues at Urban Health Plan see this quote-unquote long COVID frequently, or is it one of the factors here?
Most definitely.
Wow.
I mean, that has been a topic that we just a few hours ago were having a discussion internally in our best practices committee, where we're trying to address our needs of our patients. They're coming in with some of these lingering symptoms, and it could be a constellation. Some are very vague, some are very intermittent, some come and go. It's been difficult for us to. So we're sort of thinking about almost thinking of it as a vital sign, right? So getting used to asking people, have you had COVID? Right. So that's a starting point, because if you don't ask that question, you could start off doing this $1 million workup and evaluation, trying to figure out this, what this weird thing is.
Wow.
But, it may be a post-COVID condition. And, so we're sort of thinking about have you had COVID as a vital sign?
Well, that it is fascinating. I guess in the broad sense, the entire, and Dr. Watkins referenced this earlier in the program, the entire health community has been dealt a severe blow to try and figure out what's what. Dr. Jacob, I used the word vulnerable communities a little while ago. Do you get the sense that people in South Bronx communities are listening to advice, are taking advice? I know certainly historically it's been communities of color in many cases that have rejected the vaccinations. Where are we at from your perspective, and what do you and your colleagues see at Urban Health Plan about that?
I mean, I think our communities that Urban serves, some of our communities were slow to accept the vaccines, but even among our patients, we have very high vaccine and these booster rates. So I think the community's coming along. I think where we as healthcare providers are failing is getting the message out to our patients, right? So the message out about the availability of treatment if you test positive, the availability, informing patients about what this long COVID is, so I still think we're not doing a good enough job of getting that message out. And, that's where I think the Bronx is lagging behind. I was able to see some recent health department statistics that the Bronx had the fewest prescriptions written for Paxlovid for positive patients.
Oh,
and that's not because there's no positivity in the Bronx.
Yeah, I'm sorry to hear that. Well, you talk about getting the message out. What can I tell you? We're doing at BronxNet. We're doing what we can specifically right now. I wonder if my crew could put up this this list up again, because I want to just review it, and it's so important. Dr. Watkins was talking about A lot of it staying up to date, getting boosted, wearing a face mask at all indoor public settings and crowded spaces, avoiding high-risk activities, limiting get-togethers to small numbers, and of course getting tested and staying home if you are sick or recently exposed. I guess, Dr. Watkins, it's difficult to change behaviors, and I'm going to give you a real example. I was at an event the other night, saw some people that I knew well. Maybe 6 months or a year ago, I would have given them a fist bump or a forearm smash instead of shaking their hands. But because we've been loosened up, I was grabbing people's hands and then realizing afterwards, I don't hang out with these people. These are not people I know. Maybe that's a mistake. Is that we're just about at the end. Is that the kind of behavioral change that you think people need to kind of internalize so that they can continue to stay safer?
I think that it comes in waves, and I think that we have to modify our behavior depending on where we are at with the wave. I think that these COVID safety alerts and some of these other warning systems are guidelines that kind of help us know when the water is rocky, when the surf is dangerous. But we also know that, when things do look better, that we actually can go back to some of these kind of normal traditions, normal ways to be in community and be around folks, because we need that part too. I think it's all about knowing when to rely on the tools that we have.
And so then your final comment for people, advice for people aside from the things that we've put up here. If you don't know, some people don't have a personal physician. What do? You get a contact information that we can tell people about?
Yeah, folks can call 311 or folks can call 212 COVID-19 and actually be connected to a medical provider through health and hospitals to actually talk to folks. If you test positive, that's how you can actually talk to someone and be screened and find out if you are eligible to receive some of these treatments. I think that's
all right. That makes a lot of sense to me. One of the things that I know personally with my own physician, and again, you talked about the health professions having to pivot. You can do a lot with telehealth and all those kinds of things. Dr. Jacob, the same thing for you. If you have an issue, you can get to Urban Health Plan, right?
Yes, definitely. You can walk into us. You can call us on our number 718-589-2440, and we can connect you. We do telehealth. We can do video visits. So please come in and seek services, whether it's with us, with one of the city facilities. Do not stay home.
That's it. And certainly you can ask questions about how to protect my family when I'm ill. Listen, we got to run. Dr. Julian Watkins from the city's Department of Health and Mental Hygiene, thank you so much. We need you, and we're really thrilled that you joined us. And Dr. Jacob, hello to all my friends over there at Urban Health Plan. And you, please take care of yourself. Be patient. I always tell my friends, be a patient, and you'll get there. And stay vaccinated. That's what we want. All right, listen, we got to go. We thank them for joining us, and thank our producers, Rebecca and Stephen, and our director is Benaya. And guess what? Next week, more Bronx Talk. Good night.